The Alberta government is revamping the rules around several parts of the healthcare system, food safety and drug coverage for one, and it's introducing private options for surgeries. The changes are outlined in Bill 11, the Health Statutes Amendment Act, and are meant to modernize the system and reduce wait times. First, the province aims to bolster food safety by creating a specialized public health team to investigate food establishments. When it comes to drug coverage and payment, people with insurance programs will have to use those first, and the government would be the backup if needed. The most controversial part of the legislation paves the way for privatizing some medical procedures, like knee and hip replacements. The province calls it the dual practice model. Doctors can elect to do surgeries in both the public and private spheres. Health Minister Adriana LaGrange says the model doesn't include general family physicians, nor urgent things like cancer treatments and emergency surgeries. And she says they'll have safeguards in place to make sure public money isn't used for private services.
I also want to be extremely clear that there will be no reductions in publicly funded procedures or services, and no Albertan will ever have to pay out of pocket to see their family doctor or receive the medical care they need.
The province also hopes the changes will encourage more doctors and patients to stay in Alberta.
When an Albertan currently goes to another jurisdiction and has a surgery done privately, we don't pay for that. But we are responsible for aftercare. And all day long, I would prefer to have surgeons accredited here, approved here, performing surgeries on Albertans here.
But the ministers couldn't say how much it would cost Albertans willing to pay. The Canadian Medical Association says it believes Alberta's private care plan will actually add to wait times. And the Alberta Medical Association says, as far as it knows, the government hasn't done a proper business case or analysis to determine whether it will work. The bill is tabled in the legislature, and if passed, the government says there's a lot more work to do. They will consult the AMA and the College of Physicians and Surgeons and other health services in the coming months. They expect to finalize the details in the spring. Natasha Reeves, CBC News, Edmonton.